Hi there. I am really excited to talk to you today about creating a birth plan that works. You guys, there are some very critical decisions that you have to make if you want your birth plan to be more likely to go the way that you want it. And so today we are going to take out some of the less talked about things that can affect your birth. We're going to decode some of the systems that you will be moving through, and also helping you understand how to reduce your C-section rates, the likelihood of you having a C-section. I know for me that I always had a plan A, a plan B, a plan C, but the desire is always for the plan A to work. So I want to give you some tools and some a better map of the systems you're going through so that you can see if your plan A is really realistic for you or not. Now, when it comes to birth, it is one of the most beautiful and magnificent things that we ever get to do. But much like climbing Everest, it is innately challenging. It has risks, and the experiences that we have as we go through birth are really unique to us as an individual. You know, I was reading a story about a group that was climbing Everest, and as they were climbing over, they put these ladders down to take them over some of the ice chasms, and two people went over, and then there was a shift in the ground, and the ladder fell. And now we have this one person that's in a totally different situation as the other people on the team, even doing the exact same climb on the same day. When it comes to birth, we all have so many variables in our life that, yes, birth is beautiful and it is natural and normal and your body knows how to do it. But it is also a humbling process where we have to recognize that sometimes things are out of our control. And based on that, it's really important that we make plans that reflect us as individuals and what we need instead of what a certain ideology or person in our life says is best for us. So, as we're talking about birth, I really hope that you're able to access some of the most beautiful gifts of birth, the growth, the freedom, the joy, the learning to become honest about your feelings and your worry, and learning how to build trust and build a team of people that you support and that supports you and truly care about you. And having that self-discovery that so many women embrace and discover as they're climbing the specific Everest of their life. I also hope that you feel the freedom to make choices that are right for you, to let go of judgment of yourself of, oh, I have to do it this way, or if I was a good mom, I would XYZ, or things would happen this way, because you already are a good mom, right? Nothing that you do is going to change that fact in the birth process. So let's make decisions that feel good and right to you, and to let go of criticisms, doubt, and other people's views of us as we go through this. And lastly, that you have that joy that at a physical, emotional, spiritual, and even chemical level, it's your right to have a positive experience as you go through your birth. So I know that not everybody has a great experience. Because of that, let's talk about some of the decisions that you will have to make that are going to affect your birth a lot more than, say, having all your preferences written down on a sheet of paper, which, by the way, is a great tool. And I hope you will write all your preferences down. And we have some great birth plans you can use to do that in the resources here. But that you will also consider the frameworks, the systems you're going through, and see if the plan you want fits the structures that are around you and the choices that you have. So today we're going to talk about the differences between the medical model and the midwifery model, the differences between working with a doctor and between primarily working with a midwife, and the difference between giving birth in the hospital and out of the hospital. And I just want to encourage you that every single one of these can be the right decision. It really comes down to looking at what are your unique needs as an individual and where are you going to get the support that you need for your specific experience, right? So as we get started, let's talk about the difference between the medical model and the midwifery model, because they are very different, and the approach to birth is going to be a completely different experience. So the medical model is very much a top-down approach where there's a belief or a foundation of the more that we normalize things, the more that we take out any variability, the more that we're able to control things, the greater we are to avoiding the worst things possible from happening. So if you're in the medical model, you are much more likely to have interventions early. You are much more likely to lean a lot on technology to get you through birth instead of on yourself to get you through birth. You marry those things together and have the power of technology and the power of yourself. And it's your job to kind of create a healthy relationship and dynamic here instead of one that's off center, right? And the midwifery model has a very different perspective of birth. In the midwifery model, the belief is that birth is normal and safe, and we're going to monitor you and we're going to trust the process. And if anything, if you have any problems, we'll treat minor problems. But if you have significant problems, we are going to transfer you into the more technological model later on, but only when you have the true need for that intervention. So you're much more likely to have, the midwifery model is typically much slower. Appointments are typically longer. You're much more likely to be seen and heard as a unique and varied individual, with interventions only when necessary, instead of intervening early to make your birth kind of fit into the curve of this nice textbook type model. Definitely both have the right place. Within the medical model, the physician is the one that ultimately holds responsibility for the outcome of the birth. And this is held in place by very strong legal systems and hospital systems. And so they have to intervene early in many cases. And on the plus side, they can really help you navigate more complicated births. When I say that birth is sometimes very humbling, I really mean that sometimes we need the technology around us and we need somebody who can guide us through that and get us the tools and support we need that can keep us safe. And you will absolutely find that within the medical model. The midwifery model, on the other hand, more views the primary responsibility for the care and well-being of you as your job, right? So you are required more to speak up about what your needs are, required more to take care of your nutrition and to keep yourself low risk if you already are low risk. The benefits of this model is that if you are low risk, stay low risk, you are much more likely to have care that's more tailored to you as an individual, care that's going to support you through the process and help you keep things low risk. You're much less likely to have C-sections, episiotomies, assistance of like forceps or vacuums during your birth if you start out with a midwife. On the flip side, if any complications do arise during birth, you will have to transfer care into the more medical model when and if something happens where you need it. The bonus is that is not as commonly, interventions are less commonly needed because you're having that more personalized care from the beginning. Okay, so that just kind of brings us to, okay, so who is doing the care for you? And you have two really big choices And do you want to see a doctor or do you want to see a midwife? A doctor is very heavily changed in pathology. Is something wrong? What's wrong? Let's fix it. Yes, right? A midwife has a ton of expertise in supporting a healthy pregnancy and delivery. Birth is natural and normal. Let's help it stay that way. Now, there are a variety of different types of midwives. So if you are going with a midwife, find out if they're licensed, if they're a professional midwife, if they are a certified midwife, what their experience level is. Most midwives here in the United States are licensed by the same medical board that licenses doctors. They carry Dopplers to listen to the baby's heartbeat. They have medications to stop bleeding after birth, oxygen. They can stitch tears. They can give IVs and antibiotics and do other things. They're very equipped to handle normal minor emergencies in birth. However, they also will be monitoring you and will transfer your care if it gets to a place where you need more technological interventions. Now, when you're thinking about, well, what's the standard of care where I live? It really is going to matter on where you live. If you're in a European country or Japan, midwives attend about 70% of those births. And typically you start with a midwife and you transfer care if and when you need to see an OBGYN. Whereas in the United States, we do it the opposite way, where we almost all start care with an OBGYN, and certain people will opt out and choose to work with a midwife. But we only have less than 8% of births at this time being attended by midwives. So really, depending on what type of care you want and what your unique risk factors are, you can have very different care within these two models. The last thing I want to point out is your choices as far as birth locations, if you want to be in the hospital or out of the hospital. Obviously, the hospital is the right place to be if you have anxiety about what if you are high risk, if you have certain reasons where you need to be there, and you might need access to that technology. It usually falls heavily into the medical model. It's also the right place to be if you want an epidural and you're going to want medical pain relief during labor. Our next video will talk about the pros and cons of epidurals and help you make an informed and educated decision that way. It can be a really great tool for the people who want it. Also, there are reasons to avoid it that certain women may value over avoiding the pain. It's really just a personal option. You are a great mom either way. If you have triggers around the hospital, if you've had bad experiences there, or if you're low risk and you want a more intimate and quiet experience or a water birth, you do have options to do out-of-hospital births at birth centers or in some places at the home if you have qualified licensed midwives in your state or your country that do home births. The beauty of these is that they are very intimate, and the amount of care people to birthing person is usually opposite of the hospital, right? Like in the hospital, you're in a room and it's typically you, your doula, if you have one, and then your nurse is primarily watching you, and your doctor will come in and out. Your nurse is coming in and out. Whereas if you're in the birth center or the home, it's you, your doula if you have one, you and your partner, your doula if you have one, and then you will have a midwife, their assistant, and potentially students who are there with you the entire time. So you get a lot more time, face time with your care providers as well, which I think you'll be monitored and appropriately cared for in either place, assuming you found a certified person to work with. So let's talk briefly about outcomes of these locations, right? So if you're high risk, you really only have one option, which is you should be in the hospital because that is truly the safest place to be if you're likely to need technology interventions in your birth, or if you're at a higher risk of needing that. However, for those of you who are pretty low risk, let's just take a look at this, because I know I was certainly surprised by this, that for out-of-hospital births, the C-section rate is actually much, much lower, as is the rate for other interventions. You will have more C-sections at a hospital. However, that doesn't mean just because you want to avoid a C-section, you should be out of the hospital. You really need to consider, do you feel safe out of the hospital? Do you feel cared for? Are you okay with transferring if you need to transfer? Do you have plans for what you would do in those what-if situations that would be covered more in the hospital? And also, please, please, please see your providers as humans. There is always a person behind the letters, and there are doctors that are slow and caring and very much have practices that resemble midwifery practices, where they have very low interventions. And there are also midwives that are very quick to intervene. So you really need to get to know the person and the results of the person caring for you if you want your plan to be likely to follow the path that you would like to go. To show you even deeper how important it is to really see your provider as a person and make an intuitive and educated choice there, let's look at the best hospitals in the United States versus the worst hospitals. You can see that if you go into one of these highly rated hospitals, they're going to give you the best care, and your risks of escalating and having your birth intervened with are very, very low. Whereas there are some hospitals where, if the majority of low-risk mothers are having C-sections, you can imagine what the picture is like when you can include all mothers, right? Where you are just most likely going to have a C-section. That is why the most important thing you can do if you are wanting to avoid interventions and have that natural vaginal birth, epidural or not, is to look up your hospital ratings and choose a location that is rated well. If you go to, for United States, those of you here in the United States, if you go to this website, ratings.leapfroggroup.org, you can look up your hospital and it will actually tell you their C-section rate. So you can look and find out, are you in one of these hospitals that intervenes less, or are you in one of these hospitals that intervenes more? And then you can have conversations with your doctor around your plan to see, well, what things on your plan are really realistic in your given location and what things are really just out of the norm of care, because in these locations, the standard of care is going to look very, very, very different. All right, now I always have people ask me, well, are home births and hospital or birth center births really safe for baby? If you're considering that option. And the results are pretty clear that if you planned a home birth, not accidentally gave birth because you didn't get to the hospital or didn't have access to resources to get to the hospital, or had a birth on the side of the road getting there. But if you planned a home birth with a qualified midwife, that there is no difference in risk for your baby, whether it's at home or in the hospital. Again, your midwife is going to be watching you, monitoring you. So assuming that you have found somebody that is trustworthy and has good outcomes and that you feel safe with, then that is a choice that you have given your risk profile. Just to give you an idea of how common home birth is, it's really hard to say as far as birth centers, because birth centers are wildly different. Some are like a home that has 2 birth rooms in it and they do 5 births a month, whereas other birth centers are you across the street from a hospital or embedded into the hospital system, but just a little bit separate from it so that those transfers can go back and forth really easily. So for birth centers, you have to do your own due diligence there. But how common is home births? You can see thousands and thousands of home births happen every year, and people are making that choice and safely and successfully making that choice. So most of you are going to be most comfortable in the hospital, and that is great. But I want you to have these options so that if you do have any triggers or anxiety about different locations, that you can really take into consideration your personal preferences, your personal risks, your partner's sense of safety and comfort, and make really, really thoughtful choices about where you're giving birth, who's attending your birth, and which model of care those two, the person and the place, fall under, so that when you are looking at your birth plan, it should be very well aligned with the people and the place that you've chosen to use during your birth. All right. So if you have any questions on this, do not hesitate to ask, as always, and we'll see you in the next video. We're going to be talking about epidurals and pros and cons, and are they worth it or not? So we will see you there, and have a wonderful and fabulous day.